Congenital cytomegalovirus, or CMV, is the #1 cause of viral hearing loss in babies and can cause a whole host of other major disabilities, depending upon when a pregnant woman contracts it. Most of us have never heard of it, but it is a global problem.
Cerebral Palsy Alliance in Australia, we're committed to supporting families and advancing research.
Let's work together to stop CMV.
At CMV Action, we believe education empowers families and saves lives. Every conversation brings us closer to a CMV-free future.
À l'association CMV France, nous faisons entendre nos voix pour que le CMV soit reconnu, étudié et prévenu. Car chaque enfant mérite de bien commencer sa vie.
At Dagegen CMV, we stand for families in Germany, Austria, and Switzerland. We are turning awareness into action, so no one faces CMV alone.
At the University of Auckland
and Hearing House,
we know that collaboration across countries
and communities strengthens our impact and our voice.
At the National CMV Foundation, we are committed to supporting families, advancing research, and sharing knowledge with the world.
Together, across continents, across organizations, and across communities, we are stronger.
And so, on July 1st, Connecticut will become the second state in the country to screen newborns for this virus. For babies symptomatic, an antiviral must be given within 21 days of birth to try and ward off more harm, which was the case with my granddaughter, Bevan. With me today are Connecticut's Commissioner of Public Health, Dr. Manisha Jutani, and Dr. Thomas Murray, pediatric infectious disease expert at Yale. Thank you so much for being here. I am just thrilled to have you. All right, Commissioner, when this rolls out, how will it roll out on the state level? How will newborns be tested and where? Give us some indication of how that's going to happen.
So for all newborns who are born in Connecticut, there are a whole host of tests that are done. And these are newborn screening tests. They may be for other genetic disorders. And we have a panel where a blood spot is sent to the state lab and a whole host of different conditions are screened for. Now, before July 1st, for CMV, only if a baby indicated some evidence of hearing loss would then a follow-up CMV test be done. Now what's changing as of July 1st is CMV will be added to that battery of 60-plus diseases that we test for, and that blood sample will come to our state public health lab to be able to start identifying how many patients test positive for CMV, how many of those infants may test positive even though they have no indication of hearing loss to start.
How is this going to help you, Dr. Murray, do your job?
So early detection is incredibly helpful in understanding which babies will qualify for antiviral testing, therapy, and medicine. So the first thing we'll do is if a test is positive, we'll follow it up with some additional testing to understand whether the baby qualifies for treatment.
How will this roll out in offices, in daycare centers? Because we know that CMV is carried in the saliva and urine of toddlers. And as we said, many people don't know about this. So how are we going to start educating women and daycare centers and get this information out to doctors' offices?
So a lot of what we used to do, even in the years rolling up to this, is try to educate people through maybe OBGYN practices, pediatric practices, daycares, as you mentioned. But still things get lost in that process because unless you see evidence maybe of hearing loss or something where you're worried about whether your child is actually progressing the way they should, you might not even test. And as we heard, it's that really early screening. We're talking about in the first several days and weeks of life. Daycare is much further away for at least the child that's first impacted. So what's happening here is that right after a baby is born is when we're going to be doing that initial screening. And as Dr. Murray mentioned, that early screening and detection is important because being able to identify those young children right up front, you can then determine is an antiviral necessary or not. Some of that we don't know right now. That's what we're going to be relying on pediatric infectious disease experts to help inform, and then be able to follow those patients over time to identify if other interventions might help them stay on track.
Dr. Murray, there is no vaccine available yet, though Moderna is working on one. How can we try to ward off getting CMV, pregnant women. And we kind of were told this during COVID because kids weren't together, etc.
So if you're a woman of childbearing age who's thinking of getting pregnant or is pregnant, the number one thing you can do to prevent CMV is to wash your hands. And wash your hands if you come into contact with surfaces that you think are infected. If you have a toddler in the house and you're doing diaper changes, washing your hands afterwards. That's one of the best ways, not just CMV, but lots of different viruses, but it's been shown that it can help prevent transmission.
And also not sharing food with your toddler while you're pregnant, or drinks. And we're all busy moms, we get busy, we do it. Just don't do it when you are pregnant. Minnesota, which is the first state to do the universal panel screening for congenital CMV, has found more than 500 cases that went undetected in the last 2 years. I am very interested to see what this is going to tell us in the state of Connecticut.
So I think until we do the screening, we don't really know. What we know right now is we probably have somewhere between 10 and 20 patients in the state who fail a hearing test on any given year right now. And then the screening is done after that. Once we start the screening, we may be in a similar boat where we have somewhere in the order of 500, or we don't know. We don't know until we start the screening to know where we are. And I think that's going to be part of the process where families are going to have to work with their pediatricians to be able to figure out those next steps. Because what we want to do is try to treat those who are going to benefit most as early as possible, but also understand what the risks might be in that process, because we're going to identify a lot more people than we are identifying right now.
Tell me some of the things, doctor, that CMV can do to a baby, depending upon when a woman contracts it. And you might just feel like you have a cold, but you don't know you have CMV.
Yeah, CMV in pregnancy sometimes can even be asymptomatic, so you don't even know that you have it at all until the baby's born. And common things, hearing loss, like you've mentioned, can be a problem. Sometimes the babies can be born with developmental delay, but it doesn't necessarily show up right away, which is why this early screening is so important. In more severe cases, you can have rash. You can have yellowing of the skin and the eyes because of problems with the liver. So there's a really wide range of ways that CMV can show up in the baby, from nothing at all to some mild hearing loss to more severe disease.
And seizures and the host of things goes on and on. In our case, our baby is almost 3 years old and she doesn't walk or talk, but it is hopeful that with a lot of therapy, things are going to happen. But that's the thing. If you have a child with CMV, it's a marathon.
Yeah.
I thank you both for being here, enlightening us and helping us to roll this out, and I can't wait to help more families and babies.